to do, and this is enough for me. Never meant to be a winner, never meant to be a quitter, but this is how I lose satisfaction. Cheap thrills, cheap tricks. Woo! It seems like the way I live. Who said I should be a big shot? Who said I should take it, tick tock? I gotta rest, I'm feeling so good. In me I know it, but I'm misunderstood. Feeling like that, well, they say it's a lie, but I gotta tell ya, gotta live or let die. I gotta rest, I don't know I could.
So, good day everyone. My name is Pabalinas from PSN1 Banner, and I'm going to show to you a graded return demonstration in health assessment, specifically this inspection. So, must first explain the procedure to our patient. So, sir, I'm going to inspect your body, sir, if there are any abnormalities, if I can see. So, first, after that, we're going to make sure to have all materials. So, because we don't have any materials really, we're gonna proceed to the demonstration. So first we must check our patient's skin if there is any bruises available or any cuts, bruises or moles. And then we must check the patient's face and eyes to see if they are normal. Can you look up to the lights? Now it's normal. We're going to check the patient's neck. So we're just gonna touch it slowly. Check the veins, the carotid veins, if they are swelling. So as far so good. So now we're going to check our patient's arms and legs and chest to see if there are any masses, bruising or bulges. So we're just gonna touch his chest slowly, his abdomen, to check if there's any abnormalities, and also to his legs. You must also check. Be sure to touch gently and be careful. And now we're going to check his muscle tones to see if he had a good muscle tone in his legs and in his arms. And we must also see our patient's joints and elbows to see if they are working fine, functioning good, and if there is any abnormalities. So sir, is your joints just good? You can move. Can you move your ankles, sir? So that's how you inspect. So far so good. Our patient is normal. His body is functioning well. His skin is normal. His eyes and face are normal. There's no abnormalities at all. So that's how you properly inspect a patient. So for our next step, we're going to execute the palpation. So first we must make sure that our patient is comfortable. We must test the patient's stability, and we must, in execution, we must use our most sensitive fingers, and then we must not prolong the pressure in one area since the palpation of the patient. So, sir, I'm going to physically assess you your palpation, sir. Is it okay, sir? Yes. So now we're going to execute the palpation. And you sit straight, sir. Also, we must do it in the back of our patient. So sir, I'm just encouraging you to breathe normally, sir. So we are done with our palpation. So for our next step, we're going to execute the percussion. So first, we're going to make sure our patient is still comfortable. We're going to use our hands, and we must tap it and we must listen to the sound it makes if there are any abnormalities. So we're just going to stop if the patient is uncomfortable, so make sure we must ask our patients from time to time. So can you sit straight, sir? So we're going to do that to his back right now. Sir, are you comfortable still, sir? So we must make sure that our patient is always comfortable. So that's how you do the percussion method. So now that we have done the percussion work, the next step is the auscultation. So we need our stethoscope to do so. So first we must still ask for our patient's comfort level. We must secure that he is comfortable with what we do. We must explain the procedure as well. So after that, we're going to check with the stethoscope and listen closely to the sounds, to the areas that we put our stethoscope in, and make sure to listen closely for any abnormalities. So sir, can you sit straight? And also encourage the patient to breathe normally. So just breathe normally, sir. Now we're going to do it to the back of our patient.